Guys, welcome to Alpha Physiopelvic Care. My name is Anastasia Varova and welcome to my channel. Today a little bit more theoretical video, but very important one. And this is based on my work. I regularly see moms, and it can be somebody, a fresh new mom. It can be somebody who gave birth a year, 2, 5 years ago and they still keep suffering. Women complaining about getting UTI infection, urinary tract infection, with sexual contact, with intimacy with their partner almost every single time after they give birth. So everything was absolutely fine. They were good. They never knew what is UTI, and after they give birth, they're like almost scared to enjoy the intimacy because they know every single time they get UTI. They might have been on countless antibiotic rounds that makes a difference. It might treat infection and symptoms. It might not treat infections and symptoms. And the circle repeats it all over again. So if this is something that's interesting to you, don't forget to press like. Let me know in the comments if this is something you experienced. And today I will talk about 3 main reasons. We can of course dig in a lot deeper in a variety of reasons, but today 3 main reasons why women get more common UTIs after giving birth with intimacy. 2 of those reasons I can help with. With the 3rd one, I kind of can help with it indirectly through the work I do. But remember, it's not something that always will be treated by one single professional. Sometimes it will be multidisciplinary approach, multi-action approach in order to tackle this problem. So number one, after giving birth, and I would like to emphasize it with exclamation marks, any mode of birth, vaginal, cesarean, is a bladder prolapse. So what is bladder prolapse? Our bladder sits nicely on our uterus, and this is why you run to the toilet. So sorry, under our uterus. Uterus sits on top of bladder. So if this is our bladder, okay, this is our uterus with our tubes, it sits on top. After the baby grows, presses the poor bladder down, by then we already might have a prolapse and partially bladder kind of drops into vaginal wall. After giving birth, if it was vaginal delivery, you know, the stress of baby exiting the vaginal canal and pressing the organs even more. If it was a cesarean section delivery, quite often a C-section scar sits very close to the bladder. In rare cases, the bladder can be nicked as well during operation. Usually, it's the scar that bothers the bladder. A prolapse can occur. And a prolapse occurs in approximately up to 50% of women within the 1st year after birth. Now, the word itself is scary, but it can be something mild. I myself have a 1st-grade prolapse of the bladder and I have no symptoms. I'm managing it well and no problems at all. I'm just aware of that. So what happens with a prolapse and why we get those UTIs? So as you know, so this is our bladder. With a prolapse, the bladder drops in and creates quite often like a small pocket, okay? Small pocket. So it's not nice and round and supported and it sits up. It's kind of droopy, a little bit like droopy. And that pocket is a perfect place for that little urine to linger even after you went to the toilet, to give space to spread to all the bacteria. Now, our uterine canal, our urethra. That's the right one. Our urethra, female urethra, it's quite short. It's about 4 centimeters. So during the intercourse, it can be vaginal bacteria, it can be some bacteria from your partner. And by bacteria, I mean something natural bacteria. We're all inhabited by bacteria. Doesn't mean there is a problem with the poor hygiene, something. The bacteria that occurs. Maybe after birth you use a little bit more lubricant, so it makes things more slippery. And during the action of sex, some bacteria might be pushed inside the urethra. Now, sometimes you need quite a lot of it in order to cause UTI, or you need a friendly environment, a bacteria-friendly environment. which this little pocket here can become. The bacteria sits there happily because we had a prolapse. It's kind of droopy, yeah. Pelvic organ, pelvic floor is a little bit overstretched, not supporting it completely. Vaginal wall is a little bit overstretched, and all the bacteria breathe in there, and you get UTIs again and again and again. And as you treat it, it comes back again. And then it becomes resistant to antibiotics, and it becomes a vicious circle. So what to do about it? First and foremost, like must have, is to go to the toilet after you had sex. The whole cuddling can wait. You finish the deed, you go to pee. And this will really, really reduce your risk of UTIs. Second of all, in order to empty this little pocket, it's always good to kind of move a little bit on the toilet as you sit, forward and back, to get that urine to move out of that little pocket. Third of all, to visit pelvic floor physio to get a proper diagnosis, all right, to make sure it is your bladder, it's not something else. We're talking about only 3 reasons, not the 103 reasons that might be. To get your assessment done, it can be a pelvic floor physio, probably gynecologist will be able to assess as well for bladder prolapse, and to get proper management plan, whether it's exercises, whether it's pessary. I will not deny that there is also surgical option, which I myself always suggest as being the last, but it exists there and I cannot not to mention it. So that was the reason number 1. Reason number 2. We talked about bladder. Now logically we're gonna move to urethra. I'm just gonna wipe here my beautiful Picasso drawing. So urethra, what I see in my patients when I do assess them, urethra after birth can become kind of more exposed. So if you see someone, generally speaking, there is always an exclusion, generally speaking, who hasn't given birth, you open up the labia minora, you can see urethra. In women that have given birth, it can be allognized, the prolapse of the bladder, the urethra prolapse. So urethra is more exposed, is dropping down. It has become more mobile because the tissue surrounding it, the ligaments that support urethra have become more mobile, more overstretched after pregnancy, after birth. So again, whenever the action of sex is happening, all the bacteria is getting pushed there, the urethra comes forward and back. It's easier to injure it. It becomes more susceptible to this kind of a friction injury. And halobacteria, I mean, especially if you are prone to a bit of yeast infection, sometimes vaginismus, all these bacteria can go on. Now, I said I will talk about 3. Well, let me jump, since we're talking about birth, in the third one. If you did have a cut, a perineal tear, especially a perineal tear or cut, yes, especially if it was a greater grade, 3 or 4, and the area between your vagina and anus has become smaller and shorter, all right? So this is your vaginal opening, this is your anus, and what sits in between, it's called perineal body. So it can be injured and shortened in birth, and if it has become shorter during sex, all these bacteria from your bum, they have to be there, all right? That's fine. Nothing to do with poor hygiene again. Especially if you do use lubrication, any type of lubrication, sometimes you put in some saliva or whatever, they move in faster. The way for them is shorter, okay? So they can move into vagina, subsequently, they might die in vagina, but if things happening and they're getting pushed inside the urethra, they get into the blood, all right? So again, wiping always from front to the back, being after sex. All right, that was reason number 2/3. Let's put that one into 2. And the third one is something that I do not deal directly as a physical therapist. However, I always make my patients aware of, so they can bring up the issue to their GP, to their gynecologist. It's drop of estrogen. It's not a secret that women are giving birth later in life, okay? Having a baby after 35, it's very common, you know, people want to live their life, they want to get more mature, more established, they will have baby later. This can lead, and as lead I speak generally, you know, generally, what I've seen in my practice, to IVF sometimes, or to the fact that the woman is kind of getting close to perimenopause, all right? Especially if she has a baby closer to her 40s, and it doesn't have to be first baby, it can be second, third, fifth, whatever, you know, any baby. So she's kind of getting in that perimenopausal state. So it's not menopause, it's hormones are starting kind of a little bit drop. So the estrogen that is keeping our vaginal tissues supple, moist, protected, elastic, is starting to drop. If she did have IVF and then she did get pregnant, she had spike of estrogen, all the beautiful skin hair, right? All the nice and moist vagina, and then the estrogen dropped after she gave birth. And especially if she is on that age category where she is getting in a perimenopause, she might feel it. She might feel it that she's a bit drier. She needs to use more lubricant, although her libido, you know, it's fine, or maybe not fine. She might feel drop in libido as well. So the estrogen, guys, the estrogen, especially here if it's kind of closer to the perimenopause. Indirectly, how do I treat it? Definitely rehabilitation of pelvic floor organs, because your estrogen is produced by your ovaries. In better shape your ovaries are, the better blood flow, mobility, there is no keloids around if you had any scars and so on, the better flow around this area, stronger pelvic floor definitely helps to a certain extent with estrogen secretion. Now, this is one thing. Another thing is, of course, quite often it's not enough, and you do need extra estrogen, and can be intravaginal estrogen. And this is not HRT. This is not HRT, okay? Many people go like, I'm 40, HRT? No. The study says that the intravaginal estrogen does not increase overall blood estrogen, all right? This is not your HRT. However, I'm not going to give here a further advice because, as I said, this is out of my depth. I'm not qualified officially to give this advice. I do advise women to think about it, to discuss it and consider it with a suitable, you know, prescribing healthcare practitioner. And quite often, only that makes tissues, again, in a better shape, that it starts to get dry, irritated, and they reduce the amount of UTIs they get with their partner, and they enjoy their sex life more. All right, guys, those were the 3.5 reasons. I hope it was helpful for you. Let me know if you got some insights. Let me know if this happened to you. What do you usually do when you have this or UTIs? Maybe what you were suggested, what you were advised. Thank you so much for your likes, for your subscriptions. Share this video maybe with the women you care about so they know about it as well. And we will see you again very, very soon.